This is some work. I'm going to talk about some work that Child Trends is doing on creating a world family map. And this is my first entrance into the international world of families, and it's been a really great opportunity to be part of this, moving from more U.S.-based research to understanding a lot of the processes that are happening in the family and effects for children in a more global context. The basic goal of the World Family Map project is to monitor global trends and global changes in a range of indicators of family structure, family socioeconomics, family processes, and family culture. I'd like to acknowledge a number of colleagues. Laura Littman and Renee Rieberg are also at Child Trends. Lori DeRose is a colleague from the University of Maryland, and we also have partners at the University of Virginia. And another great part of this project is that we have a number of other sponsors and advisors from a range of countries. And they are really able to provide context and more explanation and kind of a deeper understanding of some of the trends that we see using kind of larger international data sets. And they are also able to provide us suggestions for country-specific data sets and just kind of a better understanding of what's happening in their various countries. And we have partners and sponsors in countries like Peru, Chile, Colombia, Spain, Italy, Israel, South Korea, the Netherlands, England, Africa, Singapore, and Malaysia, Argentina, as well as in the U.S. So a really great range of representation of a lot of different countries. For today's presentation, I'll be focusing specifically on measuring family structure and child outcomes as part of the World Family Map. And as we have been discussing, family structure is a really critical aspect of the family and has important implications for children's care arrangements and for child outcomes across the globe.
If you could just speak up a little.
Oh, sure. I definitely need to be near the microphone.
The microphone's not projecting, it's capturing for video, so if you could just speak louder.
Great. So first, just a little bit more about Child Trends. We are a nonprofit, nonpartisan research center, and we are located in Washington, D.C. And our general mission is to improve the lives and prospects of children and youth, and young adults as well, by conducting high-quality research and sharing the knowledge that we get from our research with key target audiences, including practitioners and policymakers, as well as other researchers. Our work is guided by a number of key principles that I've listed here. We take a whole child approach, so looking at all aspects of children's lives, as well as all age groups and social groups. We seek ways to help children flourish, and so rather than focusing a lot on negative aspects of children's lives, we really look at the strengths and protective factors and opportunities for flourishing. We value objectivity and rigor in all of our work. We pursue knowledge development and knowledge transfer, and so we have a big focus on disseminating our work to multiple audiences and through multiple different products in diverse ways of translating our research. And we have expertise in many different methodologies and broad research topics. And I've listed a few here, including youth development, early childhood, parenting, and reproductive health and family formation. Now, just for a bit more background on the World Family Map project, this was really created to monitor family well-being and to examine how family characteristics affect children's healthy development, as I mentioned, across a range of outcome domains, and we do this for families and children across the world. This is a really comprehensive report, and it fills some important gaps in our understanding of children's families and their living arrangements. This is really the only study that covers both high and low income countries in the same study, and countries in the north and south regions of the world. We also cover a range of aspects of families, as I mentioned, and I'll go through a few of the key domains that we look at. We have, through annual reports, our goal is to link family characteristics to a number of domains of child outcomes, including physical, social, emotional, and cognitive development outcomes. And we really aim to focus on the best data that are available, and this goal has helped us to also identify places where better data are needed and how to do this tracking of data thoroughly and continuously. So our goal is to update our World Family Map annually, and so updating the data that we have with the latest data that are available across the countries. And we really aren't aiming to be universal in the countries that we cover, but more to be regionally representative, so that we have countries selected across a range of regions in the world. And the map here shows the regions that we are focusing on and where we have data on countries. And just to sum it up, the gray shaded countries are the only countries that we don't represent in the World Family Map, and that's mainly due to data limitations. But everywhere where there's some color and shaded, we have representation. For the countries that are in the World Family Map, we provide information on a number of indicators across these 4 different domains of the family, including family structure, family economics, family process, and family culture. And we identified these domains and the indicators that we focus on through a literature review of family strengths, and we developed a conceptual framework, and then worked with our advisors to really prioritize and narrow our focus on a set of the key critical indicators. And then each year we also include a special topic essay that takes a much more in-depth look at a specific topic, focused on family and child well-being. And so in our first report in 2013, we focused on the number of parents that children lived with, so we'll talk about even more about that, and educational outcomes. And then in the last report, we looked at family instability and children's health in lower income countries. And for our new report in 2015, we'll be focusing on issues related to work-family balance and how this relates to parental happiness and satisfaction, with the idea that happier and more satisfied parents that there will be some spillover and benefits to their children in terms of improved family functioning, improved parenting, which will lead to greater child well-being. Okay, here is just a listing of the specific indicators that we have selected for the World Family Map. And as I mentioned, we'll be focusing on these each year and updating data that we have for these indicators. Just a few examples for family structure. We focus on living arrangements, which will be the focus of the rest of my presentation, as well as marriage and cohabitation patterns, fertility rates, and non-marital childbearing. For family socioeconomics, we look at poverty, undernourishment, parental education and employment, and public spending. Family processes, there's some more limited data in terms of family processes, but when we can, we look at family satisfaction, housework, disagreement, kind of division of labor, parent-child communication. We would like to have more data on other parent-child processes, parental monitoring, warmth and closeness, but the data are pretty limited there still. And then also some indicators of family culture, including views on single motherhood, views on whether a child needs a mother and a father, for kind of to be more successful, attitudes about working mothers, and then attitudes on family trust. Okay, so I'm going to start with reviewing our findings from the latest World Family Map report, and I do have a few copies of the report up at the front. If there aren't enough, please let me know, and I would be happy to send you. I can get your contact information. I can send you a report. So here we look at the indicator of children's living arrangements, and this is similar to the data that we saw in the first discussion, and it's based on the percentage of children living with 2, 1, or no parents. And so this gives you a more focused snapshot on 2 regions that we examined, Sub-Saharan Africa and Central and South America. And these 2 regions had the highest percentage of children living with 1 or no parents. And since there's a lot on the slide, the blue bars show the percentage of children living with 2 parents. The orange bar in the middle is the percentage of children with 1 parent, and then the purple bar at the bottom is that's the group of children living with neither biological parent. As we heard, Sub-Saharan Africa has the highest percentage of children living with neither parent, and the numbers are at about 20% of children in a lot of these countries, including Uganda and South Africa have the highest, and Ghana and Tanzania. South Africa also has the highest percentage of children living with just 1 parent, so a large number of children in single-parent families and no-parent families, and only about a third of these children are living with both of their biological parents. In Central and South America, we also see pretty high percentages, although they're around 10%, so 1 in 10 children living with neither parent in Central and South America regions. And in the report, we discuss a number of possible explanations, and the reasons why children are living with neither parent are pretty different, we think, for Sub-Saharan Africa versus Central and South America. In Sub-Saharan Africa, a lot of this is due to HIV/AIDS, adult mortality, and labor migration. But in Central and South America, we see a lot of other changes in family formation and increasing family instability in terms of high rates of consensual unions, which tend to be more unstable, increases in divorce, more father absenteeism, and mothers actually choosing to be single and raise their children. So different processes in different regions of the world. Okay. For the last essay, we looked at family instability and health outcomes, and instability was measured by divorce or relationship dissolution for cohabiting parents, widowhood, as well as repartnering, so a mother entering into a subsequent union with a new partner, not the biological parent of their child. And we look at more chronic illness, diarrhea. We also look at stunting, which represents more of a longer-term measure of health resulting from chronic malnutrition, and then child mortality, which we really are viewing as the ultimate negative health outcome. Overall, I mean, this is a pretty basic figure, but overall we found family instability was pretty consistently linked to all of these outcomes in most of lower income regions around the globe. And we use DHS data for these analyses. The one place where we didn't see a link was the Middle East, where measures of instability was not associated with any of our negative health outcomes. And for these analyses, some of the mechanisms that we discuss are around the ability to provide adequate attention and care to children in the midst of more family instability. Also thinking about increased parental stress, less focus on children, reduced social support, declines in socioeconomic resources, and also more inconsistent parenting and co-parenting with single motherhood and partners kind of leaving that, transitioning in and out of the household. Okay, our next chart is from our first report, where again we look at links between children's living arrangements, so 2, 1, or no parents, and educational outcomes. And here we use DHS data for lower income countries, but also analyzed PISA data for middle and higher income countries. And it was interesting. We saw really different patterns of results in terms of the effect of children's living arrangements, depending on whether we were looking at lower income or middle and high income countries. For middle and higher income countries, we looked at literacy and grade repetition outcomes and found that really consistently children living with 2 parents were experiencing better educational outcomes in these areas. The results for the lower income countries, where we looked at school enrollment and being on grade for age, were much more diverse, much more inconsistent in terms of thinking that children in 2-parent families are going to be better off. We found for some countries living with just 1 parent was more protective. We found that for a lot of countries there really were no differences between parents living with 2 or 1, children living with 2 or 1 parents. We did find more consistent results for children living without either parent. So across most regions of the world and most countries, living with neither parent did have negative implications for educational outcomes. And the chart here for Sub-Saharan Africa shows a few examples where we see in Nigeria that was a case where children living with just 1 parent had higher odds of school enrollment compared to those living with 2 parents. And we see in Ethiopia and Kenya a more expected result with living with 1 parent, or actually, no, that was not significant, but Ethiopia and Kenya highlight the negative effects of living with zero parents. Yes.
So in parent, it's not a step parent. It's the biological mother, biological father.
Unfortunately for PISA and DHS, we can't distinguish between bio and STEP. So this is all bio and STEP parents combined.
Okay, and it's a parent, not necessarily a grandmother or an aunt and uncle.
Yes, it's definitely the parent. So the kind of biological parent or a partner. Yeah. In the 2006 PISA data, you can distinguish between step parents and biological parents. So in the essay, not this report, but the earlier report, we do have kind of a special analysis that we do. And the results were a little bit more inconsistent with some countries where you look at step parents in the family, it was less protective to live with a biological parent and a step parent. Okay, this is what we really wanted to get to. This is a list of the data sources that we use for the World Family Map. So I won't focus on that so much, and the data sources for family structure. But what we did want to discuss is some of the issues that we've encountered with these data sources that have led us to start really thinking about how improvements can be made to some of these data as data collection efforts are ongoing, and then I'll end with sort of what an ideal data set would look like, and hopefully we'll have some more discussion on how to prioritize some of the recommendations that we make, given that there are limited resources in terms of time and financial resources to collect these data. But some of the key issues that we've been struggling with is that a lot of the data sets exclude children living without any parents from the data, and so the denominator is children and families, but that's based on living with your parents, so we just really can't look at children living without either parent. And this is more common in European data sets. There's also underreporting of children in institutions and group settings and homeless children because of this criteria that they have to be living in a family with parents. The definitions often vary by data set in terms of how to define a child, whether it's by age or being a parent or marital status. For some data sets, we've made a decision to exclude children 18 or younger if they're already a parent. Parent status varies by biological relation. As we just mentioned, we often can't distinguish between bio and step parents. The type of relationship and whether there are foster parents. We also lack information about non-residential parents. The years of data for each country are often inconsistent, so we really hope to be able to compare countries around the same time, but in the report we often have a range of data from, I think some of the data range from 1990 to 2000. And for data sets where we can examine children living with neither parent, we use the head of household as a proxy when we're mentoring parental characteristics. Here we have a few specific suggestions to improve DHS, so thinking about future data collection, and this was presented a couple weeks ago and hopefully helped to inform some of those decisions. And so thinking about the types of measures that we have been looking at, parental survival status, we really think this needs to be collected in every country and not just in HIV countries, since this is an important aspect of children's experiences in all countries. And some other recommendations for improving the information that we're getting in terms of if a parent is not in the household but they're alive, where they are, how long has it been since they lived in the household, how long has it been since the child saw the parent, and also getting more detailed information about parental unions. The point I was making, because there's such different contexts, that we need to really step back and think about what family means in these different countries when we see these associations between different characteristics of a family, what it means to be a single mom, a single dad in these countries, what are some of the other kind of socioeconomic and gender norms and factors that are influencing this. So this is, we take more of a broad look using the data that we have, but definitely need to think through the results and think about the context and how to really kind of put the results in context and explain the mechanisms. So it's complicated. But thinking when we have data that we have more background characteristics and understand some of the more kind of culture and structural factors that are at play, I think that helps. Okay. Here's my contact information, and happy to discuss more.